welcome you all to the very first webinar of this new year and the 35th webinar of OBGY Bonanza webinar series, organized by Nima Obgy Central. Today's topic is endometriosis and its Ayurvedic management by Dr. Vinesh Nagre. Myself, Dr. Aarti Kulkarni, am coordinating this webinar with my co-coordinator, Dr. Shrutika Suralke. First of all, it's my great pleasure to welcome all the honorable dignitaries present on this virtual dais. I welcome Dr. Ashutosh Kulkarni sir, President Nima Central, Dr. U.S. Pandey sir, Secretary Nima Central, Dr. Shantilal Sharma sir, Treasurer Nima Central. Further, it's my pleasure to welcome Dr. Kamini Deeman ma'am, President Nima OBGY Central, Dr. Priyanka Nakari ma'am, Secretary Nima OBGY Central, Dr. Vishnu Bhavne sir, Treasurer Nima OBGY Central, Dr. Rajesh Utane sir, Convener Nima OBGY Central. Also further, I would like to welcome Dr. Suhas Herlekar sir, President Nima OBGY Maharashtra, Dr. Manoj Gaikwad, Secretary Nima OBGY Maharashtra, Dr. Ajay Raj Bal sir, Treasurer Nima OBGY Maharashtra. I wholeheartedly welcome all the delegates attending today's webinar. Welcome all. Let me brief everyone with few instructions to maintain decorum in today's webinar. Firstly, kindly keep your microphone on mute mode and video on off mode during the session, because if it is unmuted, it can disturb the speaker and also to the other participants. If it is very disturbing, we might have to keep you in the waiting room for a while and then we'll add you back to the session. So please kindly cooperate. So please don't hesitate to put your doubts in the chat box, or you can raise your hand. All the doubts will be answered at the end of the session. So proceeding further, we are now virtually going to inaugurate this webinar with the Dhanvantari Stavan. Please everyone fold your hands, close your eyes, pray and seek blessings from Lord Dhanvantari. Namami Dhanvantari Madidevam Suraivanditapada-padmam Loke Jararu Bhayamrutyunashanam Dataramishan Vividhaushadhinam Dataramishan Vividhaushadhinam. May Lord Dhanvantari bless us all with good health, success and prosperity. Now I would like to brief everyone about Nima OBGY agenda. Nima OBGY, that is National Integrated Medical Association, Obstetrics and Gynecological Society of India, aims to impart education in supporting and protecting the character, status and interest of the integrated medical profession in practitioners of Sri Roga and Prasuti Tantra. Nima OBGY is committed to promote services for betterment of health of the community, especially maternal and child health, prevention of ailments and diseases, the treatment with integrated approach of Indian medicine with modern science. So dear all, as you know, today's topic is endometriosis and Ayurvedic management. According to WHO, endometriosis affects roughly 10% of reproductive age women and girls globally. It's a chronic disease associated with severe dysmenorrhea, chronic pelvic pain, and major cause of infertility. So we are here to explore what Ayurveda has to say in the management of endometriosis. Today, we have an eminent speaker, Dr. Vinesh Nagre sir. He will guide us through his lecture regarding this topic. So we welcome you, sir, and it's my pleasure to introduce Dr. Vinesh Nagre sir. He has completed BMS and MS Sri Roga and Prasuti Tantra. He is associated with Shri Mauli Vishwa Ayurved Research Center, Sadashivpet, Pune. He is practicing as gynecologist since 25 years. He has also done a lot of research work which includes various effects of modern lifestyle on womanhood in relation with PCOS from an Ayurveda perspective. He has published many articles related to PCOS, menstrual disorders, infertility, Panchakarma in various newspapers like Times of India, Indian Express, Sakal, Loksatta, Lokmat, Pudhari, and Maharashtra Times. He has been awarded with Karya Bhushan Puraskar by Rashtriya Shikshan Mandal at Tiyak Ayurved Mahavidyalaya on June 2022. for his work in social, medical, and educational sector. He is also active in social work. He is working in educational sector with NGO Swaroop Vardhini since 39 years. He has some enthusiastic habits like trekking, cycling, and also he is also expert in martial arts, fighting art, eskrima. So without wasting much time, I request Dr. Vinesh Nagre sir to please enlighten us with his knowledge regarding endometriosis. Please start your presentation, sir. Thank you.
Thanks a lot, Aarti. Very good evening to all of you. First of all, I must tell you all that I'm not here to tell what is endometriosis or actually what is endometriosis from Ayurveda perspective, because I'm not that much senior person or senior Vaidya. I had done my medical practice as a gynecologist for 10 years almost, and then I turned again to Ayurveda to explore Ayurveda. I can tell you all that I turned to Ayurveda to explore Ayurveda because we learned Ayurveda in our college times and in postgraduate times, but we don't try to explore it. We just go with the modern practices and we think that in gynecology, Ayurveda cannot do much more things. And most of the treatment is done by Kai Chikitsak, means MD physician, which are our MD Kai Chikitsa. They do most of the gynec treatments, and the gynec pass out persons don't do that much treatments which actually needed. So one moment comes when I think that I must explore. I am an enthusiastic person, so I always try to explore life in various angles. So I think, why not Ayurveda? I'm exploring every angle of life. Then why not Ayurveda, which I learned? So at one point, when I was in very settled in the practice in gynecology in Pune, the heart of the city, Lakshmi Road, I had my own hospital. That time I decided I will try to explore, because whatever practice I do in hospital practice will be great. Yes, it is great. But how can I explore Ayurveda? Then I start exploring. And meanwhile, when exploring everything, I start with PCOS, then some other things, tubal block, AMH, fibroids, everything I explored. Then I came to endometriosis day by day. And many patients, after seeing many patients, I, I understand that we cannot label a patient as an endometriotic patient in Ayurveda perspective, because every patient shows some different signs and symptoms. We try to relate with grade 1, grade 2, grade 3, grade 4 endometriosis, but that doesn't help in the treatment of Ayurveda. Also, as I told, I'm not that senior Vaidya to understand Avrutta Vat. So I just go with the simple concepts. Vata, Pitta, Kapha, Panchavata, Vyanodana, Samana, Apana. So these all concepts I took in hand and then start with these simple concepts to explore these all things. So my first slide. What we always tell that water the root to enjoy the fruit. If we correctly water any tree, the roots, we will definitely enjoy the nice fruits. Then roots. What is endometrium? In terms of Ayurveda, endometrium is Raja and follicle is Artava. So one shlok is given in Ayurveda where it states Rasak stanyam tatarattam asrujaha kandara siraha. So what happens when we eat food? It creates ahara rasa, then it rasa goes to rasak stanyam tatharattam. And one part goes to directly asrujaha, that is raja. Why it happens? It happens because whenever the body Sapta Dhatu, the last one is Shukra, Sara Dhatu, creates the ovum, the body must be ready to get that ovum sperm united embryo to implanted. So whenever the body is sending one part to the regular line, Rasarapta Mausame Asli Majja Shukra, it is sending one part to uterus for nourishing the Raja. This is the main concept. So here the concept comes, water the root to enjoy the fruit. One more concept in Sushrutacharya is written, Sukshma Kesha Pratikasha, Bije Raktavaha Shiraha, Garbhashayam Puriyanti, Masat Bijaya Kalpate. So how we can take this concept? So we all know uterus is a contractile organ. It contracts, relaxes. Why does it happens? Because it has capillaries inside which has to be released to allow the flow inside the uterus toward the endometrium. The same thing happens in the ovary also. So it is called Sukshma Kesha Pratikasha, which is called capillary action, which allows the blood flow to the ovary and nourishes the ovum. So the ovulation happens in a correct way, in the correct day. And the another one, Garbhashayam Purayanti, Masat Bijaya Kalpate. Garbhashayam Purayanti, the percolation action is also important. When the vessels inside the uterus are allowed by the uterus to percolate, they allow the blood flow towards endometrium. And then only the fulfillment of the all process is happened. Ovulation is happened. The uterine in the endometrium layer, the cervical mucosa allows the sperm to enter. Then it goes towards the tube. Then it gets united, embryo get formed, and it comes to implant inside the uterus. And then only the fruit comes to our hand after 9 months. This is the slide which is saying about the causes of endometriosis. Actually, it is not needed because you all know what is endometriosis. It is just for the reference, the 4 stages of endometrium. When it spreads, pelvic peritoneum, endometrioma, bladder, rectum, intestinal peritoneum, when adhesions happens, and other organs, it is stated that it passes towards the kidney also. In some cases, it is found in brain also. So, treating endometriosis. How we can treat endometriosis? How we can look towards endometriosis? There is one simple shloka which says, Ati pravrutti sangova siranam grandhayopi va vimargagamanam chapi srotasam drushti lakshanam. One more shlok about Udavarta Yoni we have that Rajaso Gamanat Urdhvam Neyo Udavartini Budai Rajaso Gamanat Urdhvam. The retrograde endometrium is called as Udavartini. So, first slok, Vimarga Gamanam Chapi, Srotasam Dushti Lakshanam. Vimarga Gamanam. So, endometrium goes in a different way. That is called Rajaso Gamanat Urdhvam. So, endometriosis happens. Then, how can we treat this endometriosis? With the simple concepts. It is said that Nahi Vata Drute Yonir Narinam Sampradashyati Shamaitva Tamanyasya Kuryat Dosasya Bhishijam. Shamaitva. We know one shlok in first year. It is stated that Vata Pangu, Kapha Pangu, Pitta Pangu, Pangavo Maradhatamam, Yatra Niyanti Vayunam, Tatra Varshanti Meghavat. So, Vayu is the main thing, and Yoninam Vatalanam is Vataladhyanam is another shlok. So, we know in Yoni or in reproductive system and another all things, we have to take consideration of Vata. Because if Vata is Prakopit, Sramsa, Vyasa, Vyada, Swapa, Sadarup are the symptoms we can see. So, these are all symptoms can be seen in endometriosis patients. So while treating that shlok, again we have to take in consideration Sukshma Kesha Pratikasha Bije Raktavaha Shiraha. So, in endometriosis, we have seen many patients with tubal lock, endometrioma, adhesions inside the uterus, severe pain also. So, capillary action is hampered. So, if we want to treat endometriosis, we need to improve that capillary action. No one knows exact cause of endometriosis. It's all papers are written by taking the data, but no one knows the exact etiology of endometriosis. So we have to focus on treating endometriosis, not on focusing on how it get happened. One thing I can say you that by the experience of 25 years and seeing hundreds of patients of endometriosis, I come to one conclusion that the endometriotic patients are always in tremendous stress. Stress is not one thing. Many patients are in stress. They speak out and relieve the stress also. The stress comes and goes. It is going on. But these patients, endometriosis patient, doesn't speak out. They keep all things in mind. They don't speak to anyone, not even with her husband, not even with her sister, brother, mother. All things happening in their life, they just keep in their kosher, manomaya kosher. And that stress, tremendous stress, creates a tremendous disturbance in the reproductive system, which leads to endometriosis. If we speak to them, what stress you are having, speak with me as a counselor. Don't treat the patient first with medicines. First of all, sit in front of the patient and talk as a normal person. Ask them, what do you like to do? What are your habits? How do you live? What things you do? Everything, Ayurvedaha, the knowledge of life in, of that patient sitting in front of you. First thing you have to do, understand your patient. If you are going to treat endometriosis, you need to be a good counselor. First thing, you need to be a good counselor because if you don't understand the patient, she will not tell you also that what stress she is carrying. I have seen some patients which comes to me when they comes to me, they are coming in the my cabin by opening the door and just they are very drowsy, lazy, and not showing any sign or any emotions on their face. Just coming calmly and sitting and just listening to me what I'm telling. Then they're thinking that what this doctor can do. So many doctors have done, IVF has been done. Now what Ayurveda can do? And when they are asking me about the treatment, I always tell them, don't talk about the treatment first. Just let it go. First, talk with me what stress you are having. And then I literally tell you, when I tell this patient, tell these things to patients, almost 80 to 90% women cry in front of me because they want to tell someone what the stress, what tremendous uh, things they are carrying in their mind, but no one going to listen. And when they start crying, their husband asks me, "Oh, how does this happen? Oh, why she's crying?" I always talk to her. But just talking and understanding are two different things. So I always do the counseling of that husband also that try to understand her feelings. Don't just try to listen, understand. Do different things with which she will feel happy, she will feel free, and it just works magical. I always see, I have seen results in patients in 2 months, 3 months, 4 months. Endometriosis patients are really difficult to treat, but I have seen the such things when the husband supports her parent supports from mother side, from husband side. When they all support, the treatment completed in very short span of time. So you have to be a good counselor to treat a endometriosis patient. Now about the treatment. A very simple shloka is given. Vatasya upakamaha sneha sredaha samshodhanam mridu. स्वागोम्ल लवणोष्णानि भोज्यान्यभ्यंग मर्दनम वेष्टनम प्रासनम सेको महापौष्टिक गौडिकम स्निग्धोष्णा बस्तयो बस्ती नियम सुखशीलता बस्ती You have to give, but this should be Sukhashila. So, talking about Panchakarma later, what I have experienced in last 2 years, I will try to share with you. Not going to tell you, but share with you because I always explore some different things to treat my patients. Why Udardhara? That is one question. Why Udardhara? I have not done this in last 23 years. Okay. So last 2 years only I'm doing this Udardhara. How this thought comes in my mind? That is first thing. Aarti has told previously, I work with one NGO. So in that NGO, we have a lot of students, almost 600 students working under us in different branches. Every day they play 1 hour, and while playing, they have injuries. So I always think what we can do for them from either side. There also I explore the treatments. So previously they are going for plastering and that painkiller treatments and everything. But from last 3 to 4 years, we are trying to give dhara, pichu, lep, and all anti-inflammatory drugs to them for relieving their pain, their strain, their fractures, everything. One of our student had got fracture on his right palm, thumb region, and we avoid the surgery. We don't fix it with orthopedic surgeon. We just treat it with Ayurveda, and now he can put that dhol. He can just bang that dhol easily with that hand. And orthopedic has told him that after doing the surgery, no, don't do that dhol vadana because you cannot do it. It will hamper the bone. And now he can do it. So while doing that all treatments, I just thought in mind, if dhara relieves the pain, if dhara relieves the edema, if dhara improves the capillary action, why not in abdominal region? Maybe other Vaidyas have done it, but that information not transferred to me. I have not heard, I have not seen anyone, I have not discussed with anyone about Udardhara previously. So, primarily, what we do, primarily we have one lecture, thanks to that Sushmita Dhopeshwarkar madam. In one lecture, she has told you can do Udar Pichu for dysmenorrhea. Okay. So she has told Pichu, Udar Pichu for dysmenorrhea, Manjisthadi oil, Pitta Shotha, Charaf Chikissa. So we try to do Pichu in some patients, around 10 to 12 patients. And same time, we have that one student which has fracture and we treat him with Dhara and Lep. So I think if we are going to do Pichu, Udar Pichu, why should not we try for Udar Dhara? So that time, one patient comes to us, which is having just menstrual cycle in 2 to 4 days, premenstrual pain she is having. We just explained to her, Udardhara, we can do, and we have not done it previously. I explained to her that this is my experiment, okay? But we know that it can relieve your pain. Can you do it? Patient tells me, yes, doctor, I believe in you. Because whatever you are telling, that is scientific. So, yes, I'm ready to do it. We do the Udar Dhara for 20 minutes. First day, second day, third day. And fourth day, she is having menses and she tells us the pain is reduced to almost 80%. So we were very happy to see that, oh, we tried to do one more experiment in our practice and it just succeeded. And it is not from our side. Actually, it is written in Ayurveda, Dhara. You can do anywhere. Some people do Shirodhara, some people do Rudhay Dhara, Janu Dhara. There are multiple Dhara. So we try to do Udar Dhara. So Udar Dhara is very useful in patients. We do it for 20 minutes regularly. Which oils can be used? Manjisthadi tel mostly are used for endometriosis patient. Sahachar oil also can be used as per patient. Maunsapachak oil, when adenomyosis fibroids are formed and endometriosis is there, we use mouse-pachak oil first and then manjisthali oil. We can use manjisthali oil and dashimul oil in the mixture also. It also relieves the pain. And after Udardhara, leech therapy. Whenever there is congestion of blood, capillaries are not open, we apply Jalauka, that is leech therapy, and it helps. So we, after doing Udardhara, apply leeches on the abdomen, which relieves the pain, congestion tremendously. Literally some patients tell me, last month we have done the treatment of Yogavasti, Udardhara and Jalauka Ucharan. This month, doctor, my menses just come like ease. There is no pain at all. No pain at all. The patient is so much relieved. She's so much happy that pain is relieved. Pain is the main factor. After that, everything happens. Uttarvasti. I can tell you, before telling Panchakarma, I'm discussing about some therapies we are regularly using. Uttarvasti is must in endometriosis because uh, there is cervical stenosis also happened in some patients. We cannot pass the cannula. But if we get successful first Uttarvasti, immediately next day we can found the stenosis relieved in some manner. After doing 3 to 6 Uttarvasti, next month we found that there is complete dilatation, there is soothing of that mucosa, the cervix is clear, os is open. So we have to do Uttarvasti in the endometriosis patients. What different oils or ghruta we use? Mainly Kshartel for Ksharana to remove the congestion, to remove the adhesions. Manjisthali tail to improve the blood circulation. Vishnu tail to relieve the vata. Snehana, Vishnu tail contains Shatavari. Yashti Madhu tail. Sometimes in Pitta Prakriti patient, we use Yashti tail, which also helps really in dramatic way. Eladi tail. Why Eladi tail? Very few people use Eladi tail in Uttarvasti. But I found in some patients there is inflammation, there is daha, uh, there is cervical erosion. And if we use Eladi tail, that erosion, that daha goes very nicely. Sahachar tail is a common oil. We can use sahachar tail with kshar tail, kshar sahachar tail, and it relieves the adhesions, it relieves the tubal block also. In tubal block, you can use manjisthadi tail, kshar tail, sahachar tail, also bala tail in combination, or dashamul tail also. One more oil I use, which is told in Sushrutacharya, which is not available in market, that is called Jivaniya tail. Jivaniyagana we took and made an oil from it. It is really it really helps in you improvising the vitality of the uterus. Many people feel that in thin endometrium we must use Falagruta, Kashmiri Kutaj Gruta, but in thin endometrium patients where they are going under IVF process and embryo is ready and they just want to improve that thin endometrium, then we start with Kshar tail first, then Sahachar tail, then Jivaniya tail. Before using Falagruta or Kashmiri Cottage Gruta, we try to use that Jivaniya tail and it gives really very good results. Falagruta is a common gruta you can use in Pittaja patient. Kashmiri Cottage Gruta, also you can use Yashti Kashmiri also can be used. So here, common thing, Panchakarma. I have written all Panchakarma actually, Vamana, Virechana, Nasya, Basti, Raktamokshana. But Vaman is rarely get used in endometriotic patients because that is mainly adho bhaga vyadhi. Vaman is not indicated in endometriosis. It will improve, it will increase the pain. So Virechana can be done. Saushodhanam mrudu. We have See, Vatasya Kurma, Sneha, Svedaha, Samshodhanam Mrudu. So, Mrudu Virechana also you can give, Laghu Virechana also you can give. It is not needed that you can do that 8 days Snehapan and those 2 days Virama and then 10th day Virechana. If it is possible, yes, you can do it. But if pain is relieved somewhat with other therapies, then you can do the Virechana. Otherwise, do Samshodhanam Mrudu, do Laghu Virechana or Nitya Virechana. We use Mahamanjusthari Kada to give the Nitya Virection to that endometriotic patient. It also gives very good results. But you have to just take care that Mahamanjusthari at one stage creates some bad symptom also. Then you have to shift to Laghu Manjusthari and stop it. You have to shift then. There are three steps. First, Mahamanjusthari, then Laghu Manjusthari, and then Jingi Sharadi. That is Sariva Manjishtha Yoga. You can shift the axis to that Jingi Sharadi later on. Nasya, yes, Nasya definitely helps. Balatel Nasya, Anutel Nasya, uh, Ashwagandha Tel Nasya to relieve the mental stress also. So it is helpful. Basti and Raktamokshan. Basti, when patient comes to you and she's in a hurry, you can give Matra Basti. Matra Basti also relieves the pain very immediately. Any hospital person also can give the Matra Basti because you don't need that Panchakarma table also. You give the Bastis to pregnant women coming to delivery. So Matra Basti can be given Searcher oil 30 ml, Dhanvantari tel 30 ml or Dashimur tel 30 ml. Just 30 ml enema, give it, Matra Basti relieves the pain. If you have set up or you can send patient to someone, do yoga basti because yoga basti gives really good results. 8 days basti. One thing you have to keep in mind: two parts. Shodhanena Shamana or Shamanena Shodhana. What first you want, Shodhana or Shamana? If you want Shodhana more, then in 8 days you have to give only 3 Anuvasan Bastis and 5 Niruha Basti. If you want Shamana more, then you give alternate Anuvasan and Niruha, where only 3 Niruhas are given and 5 Anuvasanas given. So you have to check the patient carefully what you want first. Shodhanena Shaman or Shamanena Shodhan. And accordingly, you can decide Anuvasan Basti how much and Niruha Basti how much. Kalavasti, 16 days. Kalavasti can be done for 16 days and it is really useful. Someone chats. Oh, no. Okay. And Prajasthapan Basti. In Sushrutacharya, Prajasthapan Basti is also explained for 21 days. It is said that if you do the Prajasthapan Basti, the Basti Dravya goes to Shukra Dhatu, Shukra Gamitva. And I have seen this thing in 4 to 5 of my patients where miraculous results have happened. Patient doesn't give time for the Prajasapan Basti many times, but if she gives the time, it gives really tremendous and miraculous results. Also, you can see in front of you that how patient's skin is changing, how that patient's look is changing, even patient's happiness, patient lightness, everything can be seen easily every 7 days. So I recommend if patient have time, if patient have money, because Rajastapan Basti 21 days almost goes to 35-40,000, which is not affordable for a normal person. But if the patient is going for IVF, you can definitely recommend Rajastapan Basti because that is very cheapest and a natural way to get a correct
हाँ दोले आटा गुनले
Shirodhara. Yes, Shirodhara also helps. What we do in first cycle, we put patient for Yoga Basti along with Udardhara and at the end, Jalakaucharam. Then next month, if you are going for Yapana Basti, not Shodhana or Niruga, Yapana Basti to improvise the general condition, then Yapana Basti along with Sirodhara, we do 7 days Sirodhara with Mahusyadi Tel or Sthiradi Tel ek hai. Both of oil you can use. Mahusyadi Tel also is very good to relieve the mental stress, hormone imbalance, and body stress. All the symptoms get relieved very nicely. So here it is some points from my side. Actually, whenever I discuss about endometriosis, I can discuss continuously for 3 hours very easily. But why I don't put all things in front of you? Because if only I am talking, there is no conversation. I I always uh, intend to have conversation because I'm every time exploring the endometriosis patient in Singapore when I met to Priyanka. We also discuss many things because I'm just enthusiastic to know what different types of patient comes in front of us and how we can explore the basic concepts or Ayurveda as coding decoding method because every shloka is put as a code. We have to take all codes together and decode the patient sitting in front of you. So if patient gets decoded correctly, the treatment acts very nicely. I have seen that tuberculosis patient which I presented in Singapore get pregnant within 3 months. The patient undergoes for laparoscopy, metroplasty, and then tubal cannulation. Tubal cannulation was not possible, so she has advised IVF. And that time, when she has advised IVF, she came to me. We give that Yogavasti, Udaradhara, Jalakorchin first month. Next month, we go for Uttaravasti, first Manjisthadi oil for 3 days and 3 days Yashti oil, and it gives really very good results. Third month, she got pregnant. In her way, she is actually a homeopathic doctor working in a gynec hospital. She was very amazed to see the results because she was expecting 1 or 1.5 years to get the results, or she's expecting just uh, keep my uterus healthy so that with IVF I can get a healthy baby. So she's not expecting any results from Ayurveda, but we got that very good results. Many more patients are there, but uh, discussing about the cases is not important. What concepts, basics I have explored with you. I would like to hear from you any questions you have, any conversation we can have because many times when question comes, I have some another thought process which ignite me every time. And I think, yes, from your side, I will have nice questions to explore. I have just completed half an hour talking with you, but I cannot talk more alone. I don't have that habit. So I request you all, please go ahead and tell me that what questions do you have?
Thank you, sir, for this wonderful lecture. Myself, Dr. Shrutika Suralke, coordinating today's webinar with Dr. Aarti Kulkarni, Madam. And we will like to take out the question and answer session. So, shall we begin?
Yes, we can.
Okay. So the first question is, exact which day of periods we can start the Udardhara? During or before the periods?
Uh, when there is no period, we can do the Udardhara. Before, after, doesn't matter.
Okay, sir. And sir, can you advise some specific diet to prevent endometriosis?
Actually, there is nothing which can prevent endometriosis because you get to know about endometriosis when patient gets the symptom. I advise every woman sitting in front of me that make yourself free. Don't keep your all thoughts in your mind because what is said, woman can talk 5 times more than a male. Correct? So they have to speak. They have to speak. And what happened nowadays? There are nuclear families. There are working pressure. There is social pressure. So they don't talk much. They just go on mobile and do the chatting and other things. But they don't talk more. So you have to tell your patient that you have to talk. You have to go out of your home, go for that different travel, everything. Then you can explore yourself. Explore yourself. Then all symptoms is relieved easily.
Okay, sir. The next question is, how can we manage infertility patients, those who are associated with endometriosis, at the same time using Ayurvedic approach?
I can't get it.
if a patient comes to us with infertility and associated with endometriosis at the same time, so
Yes.
what should be the approach regarding Ayurveda?
The same approach I have told, because infertility is there or not is not important. What we have to do, we have to create the healthy environment around the reproductive system. Many times, patient comes with only one or two symptoms. When we can't understand what to do, just keep all things away and think about keeping that environment healthy. If the environment becomes healthy, patients get pregnant easily. Then you do the reports, ovulation, you can check about the endometrium thickness, everything. But one thing, again, one point I have not told, because when patient comes, I explore it.
अरे थांब 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 काहीतरी केलं तू याला.
Okay, the person is muted.
Participant, please mute yourself.
Okay, no sound is there. Fine. What we have seen one shloka, Rutu Kshetrambu Bijanam Samagrat Ankurata. Correct? So, first point, Rutu. Rutu is very important. The climate of the body changing as per season, changing as per ovulation, changing as per endometrial changes. Every times it changes. It is said that Vayoho Ratri Bhuktanam Tenta Madhyadika Akramat. Vata Pitta Kapha goes along with age, along with Ahoratra, along with the food. Correct? So, accordingly, the body temperature changes, and that change happens in endometriosis tremendously. So we need to control that temperature. So you have to advise your patient, first of all, sleep at correct time. 10 is the correct time, 10 or 10:30. After that, don't allow your patient to be awake. Patient must sleep at 10, 10:30 and get out of the sleep at 6 a.m. 5:30 is really good, but 5:30 is not possible, then 6 is okay. Don't allow her to sleep after 6 or 6:30. It will definitely create a pressure in the body. It creates heaviness. Waking, uh, awaking at a late night creates dryness, heat, more pitta pradhan symptoms, and in the morning she sleeps till the late time. It creates the heaviness. Kapha 6 to 10 there is a kapha, and if she doesn't get awake at correct time, that will definitely create the heaviness. It all get it changes in the body. And one more thing, it is told that energy cannot be created or destroyed. Energy can be converted from one form to another form. In body, every time the energy gets changed. Peripheral circulation, central circulation, manages everything accordingly. In winter we shiver, in summer we sweat, correct? So that temperature changes, if happens correctly, endometriosis get treated correctly. So advise your patient to have correct sleep, have good exercise. We don't want to send the patient to Olympic. Just make your body free and fresh. Just had little sweat on your body in winter season also. You'll feel fresh, and have the food on right time. Don't take vidahi and all other that spicy and other foods, that namkeen foods, salty foods. That will create lavanam shukranashanam, correct? That also creates more heat that disturb the climate in the body. So Rutu, that first factor, if doesn't get balanced, you will always have the patient with not also endometriosis, but unexplained infertility. Many patient comes with unexplained.
अरे
So there is nothing like unexplained. We can explain everything. So we have to take in consideration that Rutu is the main factor we have to look for. Yes.
There's one more question. That as a patient of endometriosis interna, per abdo, she feels 18 weeks, nulliparous, age 35 years. USG reveals adenomyosis, collection of 640 cc. So the patient cannot be advised hysterectomy as she want to conceive. So how should we treat such patients?
The same way, if the collection is more, don't go with the Manjeshthari oil, go with the Sahachar oil. If we do the Sahachara Dhara and closely monitor the patient, we can see that Sahachara, easy circulation. The name itself says that Sahacharam is easy circulation. The best Vatahara oil is Sahachar oil. Whenever we treating patients that amenorrhea, we tell them take Sahachar tel Matra Basti and immediately the patient has the menses. There is so much Vata Shamak. We can use the Sahachar oil as a Uttar Basti, sorry, for Udaradhara, Basti, Uttar Basti. Everywhere you can use Sahachar tel, which relieves the Shotha edema early. Also, after Udaradhara, you can apply Jaloka. You can have lep on that abdomen, lower abdomen. It will definitely relieve the symptoms. And if the that adenomyosis is more, you can add Mausa Pachata in medicines. Also, if the patient is affording, definitely use Hirak Basma, 10 milligram per day. Also, some pharmacies have that Hirak Rasayan tablet, which is 12.5 milligram tablet, which can be given daily, and it gives really very good results. Also, if you want to relieve the edema, Triphala Guggul and Tappe Diluho are two very good medicines. We use it in that joint pain, joint sprain patient also. So we use this in only also this Mausapachak, Triphala Guggul, and Tappe Diluho, along with Kaishar Guggul, along with Mahamanjishtha along with Shwadanshtradi, along with Chandraprabha, and this patient will definitely get the results.
Should we consider Pitta predominance or Vata predominance in this case?
There are different things. Actually, I have to tell two more things for you. What I told, Rajaso Gamana Urdhvam, that is Udavartini. But when we see the picture, actually endometriosis picture in laparoscopy, what we see, there is Visarpa. Just like whatever told in Visarpa, we can see that uterine lining outer of the uterus, every adhesion, just like Visarpa. There are pitikas, there is inflammation, and if endometrium is having blood flow and going in a Tiryak way, we can consider it also Tiryak Rakta Pitta, correct? So whenever we treat the patient, I collect the treatment from Visarpa, Tiryak Rakta Pitta, Udavarta, and in patient, there may be Pitta predominance, there may be Vata predominance. Patient to patient, we have to see what we have to consider and what we have to give. That's it.
Question is, what is the significant role of investigating CA125 in endometriosis, as we advise CA125 to such patients?
So definitely we can advise it, no problem at all. But every time CA125 doesn't give a conclusion, correct? It's not conclusive test. We have to do other tests also, correct?
Yes, sir. Right.
Yes.
Okay. So, and what is the emergency and effective line of treatment if the patient is diagnosed with endometriosis and comes to us with complaint of continuous heavy bleeding?
If there is heavy bleeding, we can give Chandan Bala Lakshadi Tel Basti 30 ml Matra Basti continuously for 7 days. One more oil, Lajjalu oil. We have to prepare it because cannot be get available easily in market. Maybe on Amazon we can get. I have made it from my farmhouse because we have many Lajjalu there. So Lajjalu oil or Chandan Bala Lakshadi Tel is very easily available. 30 ml daily. You can just give it to 7 to 8 days. Many symptoms get relieved along with Shata Dhauta Ghruta Udarapichu. Apply the Shata Dhauta Ghruta to one gauze in a good quantity. Don't apply little quantity. Apply in good quantity. Keep that Udarapichu for twice in a day. It definitely helps. And other things also you can give, but Matravasti and Udarapichu of Shata Dhauta Ghruta definitely it helps.
Okay, sir. So the next question is, can Uttar Basti be given in adhesions post endometriosis?
Definitely, endometriosis patients in any stage can be done Uttar Basti. If you have relieved the adhesions with surgery, it is really good. What we have read that Tatra Dhanvantari Adhikaraha, correct? So it is already told in Ayurveda that whenever surgery is required, you can do the surgery. And nowadays we have so many good surgeons in hand. Also, our Nima Obgy society has very good gynec surgeons. They have to go for the surgery if needed. And after surgery, if you do that Basti, Udardhara, Jalokaucharan, and Uttar Basti, I already told, Shar Tel, Sahachar Tel, Manjisthali Tel, Yashti Tel, definitely give very good results because tissue repair is very nicely done by Yashti Tel. Tissue repair is very well done by Yashti Kashmiri. Kashmiri Kutaj Gurta. Kashmiri Kutaj Gurta gives very good balance in the uterine lining, in the Raja, endometrium. So you can use it, definitely use it.
The next one is, does the treatment as per Ayurveda change according to the site of endometriosis?
I don't think so because we don't change the treatment as per site. We change the treatment according to the symptoms. What you asked me, pitta predominance, vata predominance. So we look for that symptoms. If patient is having malavashtambha, not passing the stools correctly, we take into consideration. If patients have that blenching, bloating, nausea, vomiting, acidity, then we take into consideration. Everything is taken into consideration, not the site, because endometriosis is happened and it is giving the that symptoms. So we have to just take consideration that this is the patient of endometriosis. What is told in Ayurveda? Garbhot padasya dhatunam sreshta karma kramasmritam. So creating a embryo, that dharana is done by whom? Dhatunam karma sreshta lekin kramat smritam. So krama se hota hai. So we have to focus on that sapta dhatu. We have to nourish sapta dhatu by medicines, by changing the habitat, by changing the lifestyle, and we have to make that dhatu saraka first. And along with, if we treat local treatment, that is Yogavasti, Udardhara, Jalokaucharan, Lepa, Pichu, Yonidhavana, and Uttarvasti, it gives very good results.
What kind of lap, if we advise, which dravyas should be advised for lap?
Lep, if Shotha is there, Punarnama is a drug of choice. Koshtha is drug of choice. Manjishtha is drug of choice. Punarnava, Koshtha, Yashti also can be used. Devdar also can be used. You have to look after that for what purpose you are going ahead. Shothagna for Shothagna Koshtha, Devdar, Manjishtha is very good. Punarnava, if edema is more, then. Lep, I have not used in many patients because many symptoms get relief only Dhara Jalokaucharan. Lep is used in only 1 or 2 patients. There is no need to go give lep actually. As you have discussed a case with me, that patient can need lep because lep take out that shotha, that liquid fast. So we have to apply the lep to take out that liquid from that cyst, adenomyotic cyst we have discussed previously.
The next one is, what is the role of Nasya in endometriosis? What is the mode of action? How does it works?
Basically, what we discussed, patient is always in tremendous stress. So if we do the Nasya, the hormone balance comes in a way correctly. Second thing, stress get relieved. And many patients are there who cannot undergo for Panchakarma and that Raktamokshan and Uttarvasti. Then you can give that Pratimarsha Nasya 2 drops daily, which helps for a daily purpose. If patient is not affording, at least give Matravasti, at least give Raktamokshan. You can do the Raktamokshan, which will not cost much. So Nasya, Pichu, Matravasti, and Raktamokshan can be done in any patient who is not affording.
Okay. So the next one is that some patients with endometriosis are seen with hyperprolactin levels. So how can such patients be treated?
In my college times, when I was doing MS, I have read a paper which was published that time, which is stating Sahachar oil can be used in hyperprolactin levels. So here also, if we give Sahachar oil, Matravasti, if we give that Sahachar oil capsules available in the market for oral purpose, if we give Uttarvasti, definitely prolactin level goes down. It is very well seen that if using Sahachar oil in Basti, Uttar Basti, everywhere, the prolactin level goes down and comes to the balance easily. It is not my world actually. I always tell what I do, I explore what other way they are doing, what papers are published, and I collect the data and try to explore it is really working or not working. And I have seen Searcher oil really works very good in hyperprolactinemia.
And what kind of yogasanas can be advised to such patients?
Actually, what kind is not important, but she has to do exercise. One thing. Okay. If pain is there, you can advise only Surya Namaskar, Paschimottanasana, Trikonasana, Vrikshasana. There are many asanas actually which will not create more pressure on her abdomen starting phase. If patient is getting relieved nicely, she can go for yogasana along with slow running. She has to go for more explosive exercise day by day, because if she doesn't improve her climate balance in the body, peripheral circulation and central circulation, the endometriosis doesn't go away correctly. She has to feel free after doing the exercise. I have seen many patients which are doing regular yoga, but they're just doing it, not enjoying it. So a lady must enjoy her exercise. So I advise all patients do Zumba, dance, aerobics, badminton, which gives explosive energy, because these are not giving stress on your body much more, but giving you very good happiness. So if a patient is comfortable after yoga, going ahead for next exercises, always advise them running, swimming, cycling, Zumba, dance, aerobics, definitely. Badminton also. Yes.
So I think we are done with the question and answer session. So thank you, sir. Thank you so much for your brief explanation. I hope all the doubts and concepts in the treatment protocol is being cleared to everyone. Thank you so much, sir, for giving your time to us and also your efforts regarding the lecture. Also, on behalf of Nima Obgy Society Central and Nima Obgy Society Maharashtra body, I would like to express my gratitude to Nima Central President Dr. Ashutosh Kulkarni, sir, Secretary Dr. U.S. Pandey, sir, Treasurer Dr. Shantilal Sharma, sir, for the remarkable support. I extend my gratitude to Anima Obgy Central President Dr. Kamini Dhiman, ma'am, Secretary Dr. Priyanka Nakade, madam, Treasurer Dr. Vishnu Bauni, sir, and convener Dr. Rajesh Utane, sir, for supporting and guiding us to conduct the today's webinar. I would also like to thank and extend my gratitude to our eminent speaker, Dr. Vinesh Nagare, sir, who took time for the busy schedule and delivered us such a wonderful lecture. I will further thank Anima Obgy Maharashtra President Dr. Suhas Hirlekar, sir, Secretary Dr. Manoj Gaikwad, sir, Treasurer Dr. Ajay Raj Bal, sir, for all the support to conduct today's webinar. I would also like to thank Dr. Girish Daga, sir, and Prajakta Patil, madam, for all the help and technical support. Last but not the least, I will thank all the delegates who participated today. Without them and without their participation, this webinar would have not been conducted. Now, with the due respect of all the dignitaries, I would like to end the webinar. And we have also arranged a webinar on 20th of this Jan regarding modern aspect of endometriosis. So please do attend. Thank you, sir. Thank you so much.
Thanks a lot for hearing patiently. Thanks a lot.
Dr. Shrutika, you can end the meeting.
Yes,